This is part 3 of chapter 43 in the MDA book. This is our final lecture over this chapter. We'll be speaking about composite resins. Composite resins are most widely accepted material of choice by dentists and patients. These are placed mainly in the anterior teeth because of their aesthetic qualities. With new advances, they're increasingly being placed in the posterior teeth as well because they can withstand those forces. Originally, composite was not as strong as amalgam or cold restorations, but now they're designed to meet specific needs of an area of the mouth or tooth. Indication for using our tooth-colored or composite resin material are going to be our class 1, 2, 4, and 5 restorations. Restoration of surface defects such as hypercalcification, trituration, abrasion, or any congenital abnormalities. To close a diastema or space, and any aesthetic contouring of teeth like peg laterals. Remember, when we're placing composite, we need to make sure that isolation is a priority. When we're placing, if we have poor isolation or poor oral hygiene, our composite is more likely to fail. Contraindications for using composite resin would be patients with a high incidence of caries or oral hygiene habits, teeth affected with abnormal or heavy occlusal stress, and then also it is a little more costly for our patients. Composition of composite resins, a chemical mix, which includes organic resin matrix. It also includes inorganic fillers, a coupling agent, and then tooth-colored pigments. The resin matrix is a fluid-like material. This is referred to as bis-GMA. The fluid, which is a monomer, is used to make synthetic resin. By itself, it's not strong enough to be used as a restorative material. So we use the addition of fillers and coupling agents to allow polymerization or curing to take place. The fillers include quartz, glass, silica particles, and colorants. These fillers are going to add the strength and characteristics that are needed in a restorative material. The amount of filler, particle size, and types of fillers used are important factors in determining the strength and wear resistant characteristics of the material. We also have hybrids. These are composites that have a combination or mixed range of particle sizes. These are going to make sure that our composite is polishable and also strong. Types of composite include our macro-filled, micro-filled, hybrid, flowable, and then our sealant. Coupling agent strengthens the resin by chemically bonding the filler to the resin matrix. To achieve this, the filler particles are coated with an organic silane compound. Silane portion bonds to the quartz, glass, and silica fillers, and then the organic portion bonds to the resin matrix, thus bonding the filler to the matrix. There are a couple differences between amalgam and composite. One being the cavity preparation for a composite resin is designed to hold the resin material by means of a bonding system, so we don't need those retention grooves like we would in the amalgam preparation. Specific dental materials cannot be used with composite resins. We want to always make sure that we're looking at the manufacturer's instructions. A matrix system will vary with composite resins. Placement of composite resin is accomplished by increments. Light curing is performed before additional increments are then added. With composite, they are great when we're looking at aesthetics, so we want to make sure that we're matching our shade for our patients. So we will use a shade guide that's provided with the type of composite that we're purchasing. And then we want to also make sure that we're looking at the shade in daylight with our overhead lamps. If we have a window available, standing by the window might be something that would help us choose a shade, and then also having the patient involved in choosing the shade. Composite resins are supplied in a single paste, light-proof syringe or individual units. The paste contains both photo initiator and admin activator that will not polymerize until it's exposed to the curing light. It's applied in a kit that includes varying shades of the composite resin, along with etching and bonding system that works specifically for the application process of that material. So polymerization or curing of composite resins is the process by which the resin material is changed from that pliable state into the hardened restoration that the patient would walk out with. This occurs with the auto curing or light curing. The exact curing time is going to depend on the manufacturer's instructions, the thickness and size of the restoration, and then also the shades. So with our darker shades, they tend to take a little more time with curing. Steps in finishing a composite restoration. Reduction of the material is by the use of a white stone or a finishing diamond. Fine finishing is performed with a carbide finishing burr and then our diamond burrs. Polishing the resin begins with medium discs and finishes with superfine discs. We may also use finishing strips when we're looking at polishing the interproximal surfaces, or a polishing paste applied to a rubber cup. Glass ionomers are one of the most versatile dental materials available. They adhere chemically to the teeth, and tooth preparation is less extensive for an amalgam or composite resin. They also release fluoride after the final set. Indications for a glass ionomer would be primary teeth, the final restoration in a non-stress area, sealant, a core material for a buildup, or a provisional.